why root canals are needed, and why they require a post, core buildup, and crown. If you've been told you need a root canal, you might be wondering why it's necessary and what happens afterward. Terms like core buildup, post, and crown may sound confusing, but each step plays a vital role in saving your tooth and restoring your smile. Let's break it down. Why is a root canal needed? A root canal becomes necessary when the innermost part of the tooth, the pulp, becomes infected, inflamed, or damaged. This can happen due to deep decay, trauma, repeated dental procedures on the same tooth, or cracks and chips. The pulp contains nerves and blood vessels, so when it's infected, it can cause intense pain, sensitivity, swelling, or even lead to an abscess. During a root canal procedure, your dentist or endodontist removes the infected pulp, thoroughly cleans and disinfects the inside of the tooth, and then seals it to prevent further infection. The goal is to preserve the natural tooth structure while eliminating the infection. Why do you need a core buildup with a post? Once the root canal is completed, the tooth is technically dead, meaning it no longer has a nerve supply. While this saves the tooth, it also makes it more brittle and susceptible to breaking under pressure. That's where the core buildup comes in. A core buildup is a filling material used to rebuild the internal structure of the tooth, especially when there isn't much natural tooth left. This helps support the final crown and restores the tooth to the proper shape and size. In some cases, especially when a significant portion of the tooth is missing or the tooth has undergone previous treatments, a post is placed inside one of the root canals to help anchor the core buildup material securely. The post provides extra stability and retention, making sure the foundation is strong enough to support a crown. Why is a crown necessary? After a root canal and core buildup, the next step is protecting the tooth long-term with a dental crown. A crown is a custom-made cap that fits over the entire tooth, restoring its strength, shape, and function. Why is a crown so important after a root canal? Because the treated tooth is weaker and more prone to fracture without the protection of a crown, especially molars and premolars, which take a lot of chewing force. The crown essentially acts like a helmet for your tooth, shielding it from further damage and helping it last for many years. In summary, a root canal removes infection and saves your tooth from extraction. A core buildup, sometimes with a post, restores the internal structure of the tooth. A crown protects the weakened tooth and allows you to chew and smile confidently again. If you're facing a root canal, remember it's a highly effective treatment that can relieve pain, eliminate infection, and help you keep your natural tooth for the long haul.